Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. In the last class, we were discussing about different assessment methods of uh, obesity, especially in childhood. Now, in this class, we will look at the principles of management. Now, this is very important. Okay, obesity has to be managed in a very systematic way, and you cannot be so leisure in the management. Yes, you should be determined, and you should be child should be educated, and parents should be also educated. And it's a multi-task program. Okay, so it should be done in a very systematic way, and we have to involve the family members, child, and also physician, and all the family members. Okay, now what are the principles of management? Now, family based and age based appropriate care should be given. Now, what do you mean by this? The focus should be given on improvement on long-term physical and mental health through the permanent changes in the health behavior rather than focusing on the weight as a number. Now, this is very important. When everybody is having, when a child is having obesity, now all the family members and even child, he's only focused on the weight. Now, suppose he is 50 kg weight or 80 kg weight, he want to reduce it to 70. And he is very crazy about reducing the weight, but actually, what I mean to say is you should focus on improvement on the long term physical and mental health. Okay, it's not a time being process. So if you reduce 10 kg weight and you'll be okay. It's not like that. So if you want to have a long term effect of this, then you have to change your behavior, food behavior, lifestyle behavior, and all other your behavior. So that modification should be done from the base itself, okay, in the day-to-day activities, then only it is long term. Otherwise you can lose weight now 10 kgs, after five months again you will gain the same weight or even more than that. So therefore, tailor the approach to the each patient, family, and associated with the comorbid factors. So this is one of the very important. Don't give important for the reduction of the weight, rather you try to change the whole behavior so that the child adopt it in day-to-day practice, so that you will have a long-term effect both physiologically, physically, and psychologically. Now, for the each patient, actually, the approach will go into different according to the family setup and also child's behavior, etc. Okay, and each child the treatment will differ because of the existing comorbidities. Some children with obesity may not have more comorbidities. Now, some may have more comorbidities. Then the treatment plan will go into differ. Okay, now staged intervention from least to most invasive depending upon the severity of the obesity and treatment response. Now, emphasize that obesity is not a chronic multifactorial disease and not just due to lack of self-control. Now, this point has to be understood that obesity is a chronic. I think I told by mistake not. Okay, so emphasize that obesity is a chronic multifactorial disease. Okay, it's a multifactors are involved and not just due to lack of self-control. And many of the people have a wrong notion that I don't have control over my eating, therefore this is happening. It may be one of the cause, but it is not the only cause. There are so many causes for the obesity. Environmental causes are there, genetic causes are there, lifestyle causes are there, food causes are there. Okay, then your occupational causes are there. So many causes are there. So always tell the child that it is not your fault. Many times it is metabolic, multifactorial origin, etc. Okay. So sometimes it is endocrinal problem, sometimes it is metabolic problem. So it is not always child's fault. So child should not have this feeling that I don't have self-control over my eating, therefore this is happening. It's not like that. It may be one of the cause. Try to correct it, and there are so many other causes are also there. Now, what is the management? So management is very important, and we will see the management in stage 1, stage 2, and stage 3. Okay, suppose obesity children comes to you and he is in the stage 1. Suppose he is in the stage 1, just diagnosed case of obesity is stage 1. Then usually we will follow a method called as 5210 method. This method is called as 5210 method. This is for newly diagnosed obesity patients. Okay, just their BMI is just getting up. Okay, then the requirement, and for them this first stage will be followed. Or usually in the OPD setup, whenever the patient comes to you, so we usually follow this method only for any Of course, for the fresh patient, this is the first line of treatment. Even for the older patients also, we will go by step. First, we will try with this method, stage 1. Okay, first method. What is that? So we will try to correct the basic healthy eating methods, and we will try to correct the physical activity, and also we will try to correct the behavioral modifications. The outcome should be improved in the BMI. So once you adopt this particular 5210 method, after 1 month or maybe 2 months, so there should be a significant improvement in the BMI. BMI reduction should be there. Okay, then it is called this particular treatment is effective. Otherwise, we have to go for the next stage. Okay, this particular type of treatment is not possible. Now, what is 5210 method? 5 stand for 5 or more servings of fruits and vegetables every day. Child should be given with the 5 or more servings of fruits. None of the other foods are given. Fruits are given, vegetables are given. So how many servings? 5 servings. Okay, so for this you can follow the rainbow method. So each one fruits vegetable for the color of the rainbow. So you can take rainbow colors, and same color of the fruit should be taken, and easy for the child to understand these things. Okay, this is also quite interesting to the child, and also child try to understand this. So that means rather giving the cereals and so many things, you try to manage through the fruits and vegetables. Number 1. So what is 2? 2 stand for 2 or less hours of screen time play. Now AAP very clearly says that below 2 years no screen time at all, and after 2 years maximum 2 hours. So you try to reduce the screen hours less than 2 hours per day. This is stand for 2. And what is 1? 1 is 1 or more hours of unstructured play or exercise every day. So daily 1 hour of exercise should be done. Yeah? Unstructural play, you can go for the exercise or running and jogging and all those things, or you can do involve the child may involve in unstructural play. The child is playing outside, outdoor games, child is playing. So anyway, the 1 hour of very prompt exercise is important. Then what is 0? 0 is 0 sugar sweetened beverages. We eat a lot of sugar sweetened beverages, knowingly or unknowingly. So that should be 0. So this is called as 5210 method. This is the first method that we will adopt whenever a patient comes to you with obesity. Okay. Along with that, in this behavioral changes. Okay, what are the behavioral changes that you have to do? Try to cook at home. Don't go for outside food. Okay, whatever may be the taste, we'll try to cook at home. Eat as a family 5 to 6 days per week. At least 5 to 6 days per week. You have to eat as a family. All the family members should come, sit together, then only you have to take the food. Then self-regulate the meals. So your mother should not say that stop it, you're eating too much. No, you should yourself realize that yes, I have to restrict my meals. This much is enough for me for my activity. I'm feeling good now. This much is enough. So this feeling the child should get. And involve in the whole family in the lifestyle changes. Now, this is very important. When you adopt the lifestyle changes, a whole family has to be involved. Suppose lifestyle changes from getting early in the morning, going early to the bed in the night. And this should be followed by all the family members. And we cannot restrict only to the child. Because if all the family members follow, then only child will also follow. Otherwise, it is very difficult. So that means these behavioral changes or lifestyle changes, what we are proposed or what we are doing, that should be done by all the family members. Then only child is also observing it and it will also do it. Okay. Otherwise, you are enjoying your life and all the restrictions are there for the child only. Then definitely the child will not do it. Involve the kids in the preparation of the food. Another thing is, so prepare home food, and while you're preparing the home food, involve the kid also. So he may bring some of the potatoes, or you may do the what do you say, curry and all of his choice. Okay, by using his choice of vegetables, etc. So this helps to child to involve in the process. So this is stage 1 method, which is also called as 5210 methods. Now, after following this stage 1 method for at least 6 months or 2 to 3 months also, if there is no changes seen, okay, BMI is not reduced and still it is same or still worsening, then we have to go for stage 2 method. So what do you mean by stage 2 method? A planned diet and daily eating habits with the balanced micronutrients should be now taken. Now we come to this planned diet. How much calorie per day you want, and accordingly you eat with the balanced micronutrients. Now, structured daily meals and planned snacks. Consult the nutritionist. By the advice of the nutritionist, you have to take the structured daily meals and also planned snacks, because most of the time we never count the snacks. Okay, so the snacks also, sometimes our snacks is almost equal to a meal. That much we used to take it, because that much of calories also it gives. Okay, so therefore snack should be very very little. Snack should not be like a meal. Now, restriction of screen time for less than 1 hour per day. Screen time, better avoid. Okay, less than 1 hour. Now, planned and supervised physical activity has to be done here. Now, this is a stage two. Planned and supervised physical activity or active play for 60 minutes per day for the behavior. Okay, so now here, there it is, unstructured play is also sufficient. Now it is, you would go for planned and supervised physical activity. Okay, now monitoring the behavior through the logs and food journaling, then planned reinforcement methods and rewards for achieving the target. In the child, you can also try these methods. Okay, so non-food rewards. Now you can say that if you are able to follow all the things, okay, not losing the weight. Okay, so whatever the lifestyle changes modification advised by the doctor, if the child is following, give him the rewards. Okay, so child will be get now more enthusiastic and curiosity, and also it also creates the interest, and he develop a positive attitude. The thing is, the reward that you are giving, it should not be a food reward. So if if you follow the lifestyle methods as advised by the doctor, I will give you a fast food. Now this should not be the reward. So reward should be non-food reward. Reward should be non-food reward. Now, if this also not works, then go for the stage three. If stage two is also not working, then we have to go for the stage three. That's called as multidisciplinary approach. That is called as multidisciplinary approach. This increase the intensity of the behavioral changes. Now you have to vigorously do this behavioral changes. You have to correct it early in the morning, going to the bed in the right time, then reducing the screen time, and doing the structural activities, physical activity, etc. Then frequent visits to the specialist is also required. Weekly visit for 8 to 12 weeks, and group visits as able to do. Make the groups and do it together exercise. Now, this is a very good thing. So you can make the groups of 3 or 4 people or 5 or 10 people. Then in a group you can do the exercise. If the singly, individually, if it is not working or boring, then you can, in the group you can do so many exercise. Now, dietitian and nutritionals, food monitoring, short-term goal setting, and the contingency management, that is also very important. Now you have to fix the short goals. Okay, so by next 1 week I have to correct this particular problem, this particular behavioral problem, this particular lifestyle problem. I have to get adjust for that. So like this, by next 1 week I have to adjust myself for early waking up. So like this, so many short goals you can keep and then proceed. Now, parental participation in the children less than 12 years to achieve the negative caloric balance is very important. Now, systematic evaluation of the behavioral changes, body measurement, and also physical activity by involving the psychologist, physical therapist, exercise therapist with the pediatric expertization. So this is also very important. So this is stage three management. Stage three management. When the stage one fails, go for stage two. When stage two fails, then go for stage three. Now go to the last one, stage four, that is tertiary care. What do you mean by tertiary care? Now, care at an established pediatric obesity center with a multidisciplinary team. Every team, all the team members are there. It's an established pediatric obesity center, and there will be obesity specialists there, nurses are there, nutritionists there, exercise psychologist is there, exercise specialist there, psychologist is there, social worker is also there. So many medications are available. Multidisciplinary action, that means multidisciplinary treatment we are adopting. For example, the physiotherapy, Ayurveda, and dietitian. So many things. Okay, so very low caloric diet should be taken, and then bariatric surgery can be also tried. So these are in the stage four tertiary care. Now, some of the medications to treat the pediatric obesity is very low caloric diet and bariatric surgery. Then orlistat is one of the important drug which is used. That is a lipase inhibitor. We'll discuss that later. Then phentermine, that is sympathomimetic stimulant, just like triptigna dravyas. What in Ayurveda we say is triptigna dravyas, just like those drugs which causes tripti, early tripti. Okay. Now, off-label use like metformin and topiramate is also used. Then that's for so many other problems. Long-term safety of medication in the children is also very important. Iatrogenic weight gain is also there for metformin, steroids, etc., and that has to be kept under that means observation. Binge eating disorders maybe there, it should be also treated. Close monitoring of the macro and micronutrient deficiency has to be also seen. Now, with this, we completed the different four stages of obesity management. This is very important. In the next class, we will continue with the barriers to care in the obesity management. Barriers to obesity care management, especially in children. So that we will see in the next class. Thank you very much for your listening, and please don't forget to subscribe my channel, and also please give your valuable comments.